Please, is blood transfusion another treatment for sickle cell disease? Since there is a loss of red blood cells in sickle cell patients, if yes, how is it done?
Okay, so in children with sickle cell disease, blood transfusion is not done on a routine basis unless it is absolutely indicated. Remember, even though these children are losing blood cells on a chronic basis, the body is also trying to manufacture blood cells. But whenever there is an acute reduction, when there is a sudden drop in the blood levels, and that affects other organs such as heart and liver, that's when these children are indicated to have a blood transfusion. And another indication is when there is reduced blood supply to certain parts of the body, such as brain, that puts the child at risk of a serious complication such as stroke, then that is another indication that you need to actually improve the blood supply to the parts of the very important part of the body, such as brain. So that's another indication for routine blood transfusions in these children with sickle cell disease. Remember, blood transfusion comes with its own problems. So first is the transfusion transmitted infections. There are so many germs that could be, I wouldn't say that are transmitted, that could be transmitted by blood transfusions, even though there are rigorous tests done to diagnose and eliminate the possibility of certain viral infections such as hepatitis, HIV, and all that. There could still be a very small possibility that cannot be ruled out. So transfusion transmitted infections is a very big problem. And also, every unit of blood that is being transfused comes with a huge load of iron. So if a child receives regularly blood transfusion, there is a risk of iron overload that also is quite detrimental for the child's
All right. So it's not routine. We select the patients who need transfusion carefully, and we give them transfusion when they need it. Either their blood level has become too low, or they are at risk of a serious complication like a stroke. Then we give them a blood transfusion. Related to that question is Belinda's question. Belinda has just asked, I have realized that some healthcare professionals seem to order blood transfusion a lot for sickle cell patients. Is it a good practice? Is it the only solution to anemia? I think Dr. Rao has tried to answer this question a bit by saying that ideally the patients should be chosen carefully. You should not just give a patient blood because the patient has sickle cell disease.
That's right.
That the blood level is too low. And when we say too low, it is related to the patient, because somebody's blood level may be 6.5, HB or 6.5. The person is perfectly fine. Running around. So you wouldn't transfuse that patient. But if you know that the blood level is 6.5 and the child comes with a blood level of 4 and is having other problems, you want to
fast breathing and all that, then there would be a definite indication to transfuse. So I don't think any health professional would routinely order without any particular indications. So definitely, that's
how it's supposed to be. Okay.